So good morning, everyone. I'm Jessie from Kentucky Youth Advocates. Thank you all for joining us today, whether you're here again for the first time or you have been coming for weeks now. We really appreciate all of you who are joining us today and all of you who submitted questions for today's forum via the RSVP form. A lot of those questions we passed along to our panelists today, and they're trying to incorporate those into their remarks. If you have other questions as folks are talking, please feel free to use the Zoom chat feature, and we will record those and try to get those answered later. And if you have comments as well, please share those there and we'll capture those. Just some Zoom housekeeping. Audio's muted for everybody, but your video is on. And we'll just have our panelists be unmuted. So if you could just stay muted the whole time, we would appreciate that. So I am now going to kick it over to Terry Brooks, who is going to introduce our panelists today.
Hey, thanks, Jessie, and welcome to everyone again. Just as a reminder, we at KYA are really committed to having these Wednesday kind of town hall meetings. When we say town hall, we mean that in the New England sense, where it's robust conversations, not a political rally. One of the things that I'm especially pleased with, I've just scanned the gallery and saw folks like Dr. Moonaghan and Dr. Rogers and Will Meyer. What I love about that is we really want folks to be joining us across the spectrum of kids' issues. So today we're talking about child welfare. We're specifically talking about the professional staff in that system. I'm so happy that we see early childhood folks and K-12 folks. We have representatives from health foundations on. You know that one of KYA's hypotheses is that kids don't grow up in silos. So we absolutely believe that child welfare folks need to listen to juvenile justice, and juvenile justice folks need to listen to health, et cetera. So just want to welcome everyone and especially underscore the importance of all of you being here. As you know, we have tried to make these forums responsive to COVID-19 and kids. That meant that we've had folks like Secretary Friedlander to kick this effort off. We have had legislators on, and we've had folks from sort of a grassroots perspective on a variety of issues, from the 2020 General Assembly to the state response overall to health issues. Today, we're moving toward a two-part look at the pandemic and child welfare. And we very intentionally wanted to begin by looking at the workforce. Then next week, we're going to be looking at sort of the program or kid angle. You may be asking yourself, well, why would you not have started with kids? Our hypotheses, which I know our guest, especially Dr. Miller, it will probably elaborate on. Our premise is pretty simple, and that is that if we cannot attend to with intentionality our frontline workforce, they're not able to attend to the needs of our kids. So I want you to know that we have begun this series very intentionally. A look ahead next Wednesday, as I said, will be sort of the kid equation in child welfare. The Wednesday after that, we're going to take a look at the K-12 sector, and what does that mean going forward. So let's move into the topic today. Shannon Moody, who is KYA's child welfare guru, will be facilitating this. And we have three guests that we're so appreciative, given their schedules, that they're joining us. Elizabeth Caywood is Deputy Commissioner for the Kentucky Department of Community-Based Services. She has served in that department since 1999. She's worked in areas such as public assistance and the social service programs. When I think about Elizabeth, I think about someone who is so accessible, such a good listener. And I don't know if you heard what I said, 1999. I believe that means that Governor Patton, Governor Fletcher, Governor Beshear 1.0, Governor Bevin, and Governor Beshear 2.0 have all counted on her. Now, I mean, who else in the Commonwealth can say that all of them loved her? So way to go, Deputy Commissioner Caywood. We also have Brenda Rosen. Brenda is the Executive Director of the National Association of Social Workers, the Kentucky chapter. Across her career, she has worked as a social worker in multiple states. She's been an instructor at the UK College of Social Work and currently heads up the very important chapter of the National Association of Social Workers in Kentucky. That group is a professional organization that promotes the career development of social workers and advocates for social policies. Our third guest is somebody who I consider a colleague, but I also consider a friend, and that's Dr. Jay Miller. Jay is the Dean of the UK School of Social Work. And when I think about Jay, I think about somebody who brings real imagination and voice to the table, whether you're talking about engaging youth voice in authentic ways, or really being a clarion voice when we talk about self-care for those frontline professionals. So Elizabeth, Brenda, Jay, we so appreciate you being here. And Shannon, I'll kick it to you. Knowing that Jay is your advisor in your doctoral study, I'm sure there's no pressure on you to facilitate this well. So Ms. Moody, it's your platform.
Thanks, Terry. I think we would like to start first with just some perspective from Elizabeth Caywood from DCBS to give us a sense of the state of Kentucky's child welfare workforce from the DCBS perspective. So I know that she's been given kind of a heads up that we'd love to hear some remarks from her. So we'll start with Elizabeth and then we'll jump into questions with the whole group after she's had a chance to kind of give her perspective.
Good morning, everyone. And again, this is kind of a mile high, very macro level perspective. I'm going to refer to some notes to make sure I include some details that I think were specifically requested. In general, in March, radically, in a matter of days, the Department for Community-Based Services changed its service provision, limiting those services provided in person to imminent risk of harm to a child or vulnerable adult. In addition, the vast majority of staff, aside from a skeleton crew supporting local offices, are moved to teleworking. These measures have been put in place for the health and safety of our staff as well as the client's public serve. DCBS is still fulfilling its statutorily mandated obligations, its federal mandates and court orders. There have been some federal leniencies and waivers provided to the state during this time, and thankfully they were done with some expediency. But primarily DCBS is using alternative means such as virtual and telephonic platforms for service provision. Again, service provision that does not involve an imminent safety concern or risk of harm to a child. There's been a lot of concern nationally, and Kentucky is no exception, that reporting to Child Protective Services has decreased since the social isolation measures, the closures of schools and childcare in March across the state. According to some reports that I had run for this virtual forum, we've seen about a 27% decline between reports between March of last year and March of this year, and about a 39% decline between April of last year and April of this year. Again, this all corresponds to the closure of schools, childcare, and the ordered social isolation measures. And school personnel is one of the groups that we've seen the more drastic declines in terms of reporting. Neglect remains predominant in all reports to Child Protective Services through this time. DCBS, again, has prioritized the more serious reports of maltreatment for in-person service provision and initiation, whereas other reports of more moderate and low risk are initiated through other means, unless, again, an imminent risk of harm or safety concern for a child subject to the investigation is identified. Any report can be elevated to in-person service provision at any time. DCBS and its in-home service providers are conducting visits and providing services through virtual and telephonic means, unless, again, there is an imminent risk of harm, crisis, or safety concern for the child. There continues to be specific observations and conversation with the child in both the provision of child protective services and ongoing services. In terms of foster care, we have begun conducting home visits, home studies, training for foster parents and relative and kin caregivers through virtual means if possible. We will be relaxing background check requirements temporarily in the near term to, again, help with our recruitment efforts for foster homes. Right now, we do have an adequate supply of foster care placements, but we continue to recruit. Unfortunately, one of the consequences of the closure of courts right now is that we have more entries into foster care than exits, and we have exceeded 10,000 children in foster care at this time. That is an unfortunate consequence, again, of COVID-19. Visits between foster children and their families of origin continue. However, to the extent possible, they are continuing virtually or through telephonic means. I want to also emphasize, though, that the frequency of contacts, whether it be between our staff and a foster home, or our staff and a foster child, or a foster child and his or her family of origin, we're encouraging the frequency of those contacts to remain the same, if not increased, because we realize that this is an extremely distressing time for all households, and we want to make sure that that frequency, hopefully that will relieve some of the distress that we're going through right now. And more specifically, in terms of our staffing, we do continue to fill vacancies. Our interviews and also our new employee trainings have moved to virtual platforms rather than occurring in person. We've actually seen a slight decrease in turnover in March and April. And while we don't yet have, we haven't yet pinpointed the underlying reasons, we suspect the economy and perhaps improved morale due to telework are factors that are helping to retain staff right now. Our staff are being outfitted with protective equipment. Despite the essential nature of our services, we have had some difficulty in securing protective equipment, and just recently the department has been the recipient of donations, including 4,000 masks through the Department for Public Health, and we're also in the process of purchasing protective equipment and disinfecting materials for staff's use. We're really gearing up to start to reopen some of our services in the coming months, so we need these protective materials. I think there's been a lot of questions about reopening for the department, and we anticipate the first step in terms of child welfare, which is we think will be coming soon, is in-person visitation between a foster child and his or her family of origin. That will probably be one of our first steps. We also anticipate more child protective services investigations being initiated in person. In the coming months, we do anticipate a backlog in terms of child protective services referrals, new reports of maltreatment as the state gradually reopens and more children have social interactions with those outside their immediate caregivers. We also anticipate a backlog of cases on court dockets. I want to commend the courts. They have been a tremendous partner through this time. I hope and that partnership continues with the same intensity through the recovery period. Mainly, my worry is about foster children achieving permanency, whether that's through reunification with their home of origin, permanent custody with a relative or kin caregiver, or adoption. At this time, there are no immediate plans to move staff back into the office, to the extent at least that staffing existed before COVID. We really have an opportunity now to innovate and create a new business operation within the department and state government that is hopefully more fulfilling to staff and clients. I've always had a dream of staff being more mobile and involved in their communities, and this might be a real opportunity for staff, again, to get out of the office and be a part of their communities, and perhaps have a better work-life balance. Some other things that I'm thinking about in terms of the future is that, bureaucracy can be its own worst enemy in situations like this. I think the state's been fairly well prepared for more local or regional disasters or emergencies, but not something of this international and national scale. So we must give greater consideration to emergency and disaster readiness in our policy making across the boards. Again, telework has afforded many positives. While there have been some hiccups, there are special populations such as the Amish and individuals with limited English proficiency that create some complications in using virtual platforms. We also are seeing some concern from staff that they're missing something in their observations of a home or in their discussions with a child. But by and large, staff really appreciate the telework. They do, with the reduced travel, they are reporting more time to engage with families and children, and evidence of some improvement in visits between children and their families of origin. There are some really heartwarming stories that I received from the service regions, again, in preparation for today. Being in the comfort of their homes and not having some of the personal expenses related to work. Again, staff are reporting improved morale. And we do intend to survey staff about their telework experience to inform our future direction. In general, I hope staff know that their health and safety are valued and they are essential to the health, safety, and welfare of this state and its citizenry. We have opportunity to, again, to make state government more efficient in terms of allowing staff to telework, have flexible schedules. I think we have an opportunity to be more parent friendly in our scheduling and our opportunities for telework and state government. And then, of course, reducing travel and our office footprint across the state could have some cost savings for us. And then lastly, before I turn the mic back over to Shannon, given what we've seen in other countries in terms of uptakes in domestic violence and some pretty severe domestic violence has already occurred here in our state, I want to remind the public and those on this virtual forum that domestic violence shelters statewide are open and available. Given the economic fallout from COVID, I want to encourage those who have need to apply for Medicaid and the Supplemental Nutrition Assistance Program, or SNAP, to ensure that their basic health and nutritional needs are met. These benefits are critical to preventing child maltreatment, and they're out there. In addition, I think there will be some news forthcoming pretty soon that the state has applied for a pandemic EBT, which will provide additional benefits to SNAP and non-SNAP households whose children otherwise qualify for free or reduced lunch. This benefit is tantamount to about a little bit more than $300 per child. If all people apply, we could see upwards of $163 million infused into the state and new nutritional benefits for families. I want to make sure that folks know that community action agencies have received additional federal funding to help support families and households during this time, whether it be with heating and or cooling costs or other needs at this time. I want to remind folks too that we are all mandatory reporters of suspected child abuse and neglect and vulnerable adult maltreatment. And there is information about these resources available online through DCBS through the DCBS website, as well as our social media outlets. And then lastly, I do retain grave concerns about the economic fallout from COVID and the stresses upon our infrastructures that we all need for survival. I ask that you remember Child Protective Services, foster care are largely state funded. So I do worry about austerity measures. I worry about, of course, our families and children during this time. So I hope that we all remember that child welfare belongs to all of us, and we come alongside our families and children during this time. One other thing that I'm not sure is getting a lot of publicity at this time, but we are continuing benefits to foster children who are aging out of foster care right now, because again, we realize that the economic fallout of COVID is pretty devastating and would hamper their ability to transition into adulthood and independence. So we are continuing benefits at this time, wraparound services to those foster children who age out and agree to those services. So that's a very high level summary from the department, some things I wanted to get out there, and I'll turn it back over to you, Shannon.
Thanks, Elizabeth. I think you covered a lot of really important information and details that I think folks on the call will certainly benefit from. I think what I heard from you were some things that are overwhelming, and I think in the child welfare space, it's really easy to feel overwhelmed with a lot of the things that are happening. But I also heard a balance of some hope, whether it be through innovation, whether it be through different ways in which we provide programs and services. And I would ask that both Dr. Miller and Brenda, and we'll start with Dr. Miller, maybe just reflect on what gives you hope as you consider the child welfare workforce and how folks are going to be impacted by this in their roles out in the field.
Well, first of all, thanks for the intro, Terry, and thanks to Shannon and KYA for putting this all together, and of course to folks who jumped on this morning. And happy Foster Care Month, and thanks to everyone who works to improve the lives of our system-involved young people. I think at the end of the day, if you're asking me about hope, particularly in relation to the workforce, it's the notion or the fact that I find solace in knowing that the workforce we currently have, top to bottom, side to side, they are wholeheartedly committed to doing their jobs, to ensuring the well-being of children and families throughout the state. So that is perhaps the thing that, even when it looks a little bleak, that I hold on to in terms of how we move child welfare forward. I think we need to really move to a space where we recognize that the well-being of children and families in Kentucky is explicitly connected to the well-being of our workforce. Mm-hmm. We have conducted, all kinds of research that kind of looks at this concept of wellness and self-care among child welfare workers and the connection that it has to the services they deliver. And I think when I say it, it makes perfect sense to say that, if your workers are well, they will provide a better service. But oftentimes we forget about that. And so it's really important that, number one, we understand that without a well workforce, there is no well Kentucky. It just cannot happen. One cannot invest and engage with a family if indeed they are not caring for and supported in caring for themselves. Now, that's certainly complicated in the current situation. I was on a call yesterday and I expressed to someone that child welfare was already an impossible job, and it's even more difficult now. So understanding that we need to think about the work differently. And I think it's really important that we understand that we are dealing with a different type of workforce now. You, of course, hear a lot of stuff about millennials and how folks want to work and the work from home and the virtual pieces. And I think there are a lot of possibilities in this pandemic, as Elizabeth kind of alluded to, taking some steps to think about how we do child welfare differently. The concept of remote work and not having centralized places, all of those kinds of things will evolve as we continue to work through this. It's important that we are hopeful about the supports that we can offer our workers. I think that this can also be a very isolating time for folks in terms of working from home, and then not only dealing with the issues related to the families they work with, but issues related to their own families. And so we must understand that workers are whole people. I think a lot of times we only focus on the worker in relation to the work they do for us, meaning the state, but thinking about the work that they do in other places, or the fact that in many instances they're impacted by the same thing that the families they are working with are impacted by. Thinking about what that concept of self-care and wellness looks like with our child welfare workers. You know, for the better part of 2 years, we've been working on a lot of innovations around wellness and working with employees to kind of think about and conceptualize what wellness and self-care looks like in the child welfare workforce. I think it gets tricky. I often say self-care is not a nicety, it's a necessity, but it's also a very subjective thing. And so trying to support folks in putting together and coming up with concepts that work for them. We often want to get into the notion of putting together, you know, these kind of cookie cutter approaches, and it doesn't work the same for all workers. So in summary, the people that are doing the work is what I find hope in. And then knowing that the agency is looking for and is open to innovative ways to supporting those workers is the next shoe in terms of thinking through how to actualize that hope.
Hi, can you all hear me? It's Brenda.
Yes.
Hi, what an honor it is to be on this panel today, and a shout out to everyone for absolutely everything you're doing. These times are so difficult, but I love the word hope, and I spent almost 3 decades working in physical and mental health care, primarily in bereavement, pediatric oncology, and hospice, and learned some valuable lessons, and that is that hope, there is no such thing as false hope. And it gives us different degrees of, you know, of trust and being able to always have that sense of hope. And I think given that May is Mental Health Awareness Month, part of our kind of moving towards, you know, a new normal, if there is such a thing, is really for both our professionals and our clients, is to understand the impact of our grief. And moving forward with that, you know, as we all know, grief is what we all experience inside, and mourning is when we take that grief public. And I think that in order for us to really be able to kind of help each other acclimate to this new normal, is that we really do honor those feelings of grief, and not just for related to death, but also the grief and the loss of innocence as a country. So much has changed in 8 weeks. Loss of jobs, homes, school, food. And also I think with that comes something that we're really going to need to do in supporting especially our mental health professionals or DCBS workers, each of us, is to acknowledge that often with that grief comes a sense of guilt, you know, for maybe not having it as bad as other people are experiencing some of those things. So I think moving forward, as both Jay and Elizabeth have said, we really do need to acknowledge and support and really identify these terms, especially when we're looking at how we're going to help children to be able to, you know, actualize and talk about their feelings. And the adults, you know, for our whole family, as social work, we look at the whole picture, the whole family, the impact on the individual, the family, the communities, the schools. So I think that there's some really important lessons for each of us, and that is being able to honor our own authentic selves, how this has impacted us, and how we need to be able to move forward. I think we're also seeing a lot of denial in the world, and that can also be part of those stages of grief. Sometimes we need to compartmentalize emotions and feelings and the things that we're seeing. And so I think that we're going to really need to be able to kind of move forward and to help people understand that that is not always a negative emotion, but is something that we need to do as we, as we work together and move forward. But I think we've got an opportunity, especially when we're looking at this wonderful safety net, this wonderful village across the state of Kentucky of people working together, healthcare providers, mental health providers, schools, working together to really be able to engage, educate, and empower kiddos of all ages.
Thank you for that, Brenda. What I heard, I think, from all three of you is this discussion around what families are experiencing now and what our workforce is experiencing now, and how they're whole people and they are probably dealing with a lot of the same issues that some of our families are. And considering, the trauma of a pandemic and potential unmitigated trauma that vulnerable people are experiencing now, do we think that the child welfare workforce is equipped to do their work using a trauma-informed approach? And maybe we'll start with Elizabeth, but considering Jay and Brenda both support and/or prepare future social workers, I think that's probably applicable to all three.
This is an area of recent attention and increasing attention. While we do have trauma-informed care training available to our staff, so much of it is through modeling and coaching from our management and our leadership. I will say throughout this pandemic, the department leadership and management has made a very concerted effort to reach out individually to staff, foster the team relationship that exists among colleagues to the extent possible. But it has been a very difficult time. I mean, our work is social services, our work is social work. I mean, the social precedes everything that we do. And not having that in-person contact has been very hard for our staff to absorb. We miss it. While we always had maybe some communication gaps, I worry that communication gaps have increased because we don't have that day-to-day in-person interaction. And so there are things that could go missing. There are just cues that you miss not being next to somebody. So it's been a very difficult time, but we have had some efforts in the past. I mean, Dr. Miller's spoken about some work he's done with our department. We have a partnership grant with the Department for Behavioral Health, Developmental, Intellectual Disabilities to look at post-secondary trauma, our secondary trauma in our workforce, as well as among our providers. So we're making a very concerted effort, and this is an area that this administration has dedicated attention to, something you'll readily hear Secretary Friedlander mention in any conversation about staffing, is that he wants to really address self-care and secondary trauma in our workforce. So it's an ongoing effort.
Well, and I think too, in connection, we did a study last year here in Kentucky where we looked at child welfare workers and vicarious trauma, and learned that through some very intentional self-care actions, we could reduce that trauma and as such improve the service that they are delivering. So I think part of addressing some of the trauma burnout elements is really looking at self-care and wellness not as something we do in response to a bad situation, but as something that we do as a regular part of our work. It is not separate from our duties, it is part of our duties. So when we think about ways to fundamentally change the way that we do work, it has to be predicated on this notion that self-care and wellness are paramount because it will address these other inimical employment conditions that we're talking about. Now, there are several strategies to do that. Number one is simply being intentional about it, knowing and recognizing that the work is challenging and the work is hard, and we need to fundamentally kind of change some of the framework in terms of how we approach it. Number two, as I said earlier, recognizing that the workforce is different. So what used to work in terms of recruitment will not work anymore. Or we often talk about vicarious trauma, burnout, and it always gets to almost the retention problem, right, or the retention challenge. And folks will say we can't retain workers, et cetera, et cetera. And I always, of course, ask the question, well, how long should one be retained? And I've asked it probably a million times and I've never gotten an answer because it's one of those things where there is no answer. It's about kind of understanding the dynamics related to what's impacting the work. And then number three, taking that integrated approach and understanding that it will look different for everyone. One of the questions I often get is, well, what should I do for self-care, or what should I do for wellness? And in a lot of our work, we don't focus on telling people what they should do. We focus on telling people how they should do. And that will be dictated by you and your personality and what you like. And if you're not a CrossFit person and not a fine self-care and wellness is doing CrossFit, and then I say you're failing at that, well, then we're just kind of getting into this cyclical thing. And so creating a space that allows folks to engage and address trauma in a way that's unique to them will go a long way in helping them cope with what is indeed a difficult job. And then for all of us to understand, folks have heard me say a million times, child welfare isn't a someone system, it's an everyone system. It's not a someone problem, it's an everyone challenge. And so we all have a role to play. I think just simply pitching it to the cabinet or pitching it to a worker as their sole responsibility to protect kids and keep kids safe, like that's not how child welfare works. So if we are going to address this wellness concept, we have to understand that we are all part of this child welfare system. And the more that we engage in that role, the more that work is kind of, spread out and looked at in a different way, the better off we will all be, including our workers, for it.
Self-care is something I think that has probably kept me going for almost 39 years in the social work profession, because as Jay and Elizabeth have said, I mean, it's a way of what we incorporate into our sense of who we are. Great article, it says, chocolate cake and bubble baths are great. That's a wonderful piece of providing some sense of self-care and appreciation to ourselves, but it is also how we build that into our daily practice. And I think moving forward, it's going to be really, I think we have to be very, very intentional with our wonderful social workers and social service staffs to hear what they have learned in these 8 weeks working from home in regards to that work-life balance. I think we need to give all of our social workers and our new student social workers coming out those opportunities for voice, to hear their thoughts, their reactions, their feelings, and to empower that. Also the collaboration, again, building that transparency and trust, and being very culturally, responsive to our and continued, especially as things have changed over these past weeks. I think there is one of the greatest things we can do is to, that emotional safety net, the peer support, the way that we can build and inform that into everything we do, because it's no longer an opportunity to just speak it. We have to really incorporate that in everything we do. And I give such a shout out. I'm talking to a lot of social workers across the state, and I'm fascinated and honored when I hear from our DCBS workers who were like, I've been doing this for 15, 20 years. This is my passion. I can't imagine doing anything else but this work. And I love when, especially when we're looking at new students and new social workers coming out, trying to find that step, trying to find that direction of where they want to go in their career. So I think we really need to accentuate the positives that are already and were already happening within our system in terms of that support, and then really, in informing in our social workers and our mental health professionals, what have you done to survive this pandemic? Because I think that trauma and that opportunity to learn from our professionals when this has really changed their work-life balance is critically important. And I think these are all conversations that I look forward to having, and that we're having right now, both on a state and a national level. We do need to make it okay to not be okay. And where do we go from there, and how can we really make this a walk together, and do that empathy and the kindness and the compassion that we speak well of. But I think this is the time when we really need to make that a reality in everything we do.
Jay, did you have something?
Yeah, just real quick. I want to, I know Brenda and I have talked about this before, but I think it's really important kind of moving into this next phase. And I know we often talk about this concept of work-life balance. And again, I joke with Brenda because I think there's no such thing. It doesn't exist. And I think part of the reframe in terms of, looking at work does not occur separate from life. There is no such thing as a work-life balance, because it assumes that somehow we can wake up and we can pause our life and we go to work, and that's a nice clean box, and nothing about life happens while we're at work, and then we hit time in on our life and we go back, and that those things are kind of demarcated in a way that allows us to balance them. And I think what happens a lot of times with workers, and you see it particularly with new workers, is when they feel like they can't make that happen, they internalize that as a failure and experience it as burnout and stress, etc. And so really kind of reframing and moving to a position of there's only life balance. Work is a part of your life like everything else is. So I assume, we're all on this call, and I guarantee right now somebody's kid is running around doing something, or you're going to get a text message about some groceries or something. Like, life doesn't stop because we're at work. And so we must understand that work is a part of our life. For some of it, it's a little bigger part than we want it to be. But to really embrace this concept of part of the stress is thinking that we can balance those things. And if we simply kind of reframe and think about our work, particularly now in the space of we're all sitting at home, and think about, the fact that the work is part of our life, and we're going to balance our life and find a healthy life balance, I think it would go a long way in helping people to deal with the challenge and stressors of simply managing what's happening. And when I talk to workers, so many times they have this desire to somehow keep these things separate. And if that is the goal, it's not going to happen. And so we have to kind of reframe the way we think about that goal. So let's look for and seek life balance, and work is a part of that, just like rolling around with your kids in the yard or having dinner with friends or whatever it may be. But to really, kind of reframe that concept so that we don't add stress to individuals who are trying to balance these two things that, quite frankly, can never be balanced.
I think that's a good kind of note to kind of sum up the conversation around, because we're talking about child welfare workforce. We're talking about all of the stressors that play a role for the folks who are serving our most vulnerable kids. and making sure that we are figuring out ways to create space for the child welfare workforce, or specifically social workers, to take care of themselves, as well as while they're, taking care of their families and taking care of their very important jobs. Just being intentional about that, I think, is a really really good idea to consider just pondering on as we navigate this kind of new normal. We're gonna have to wind down because I'm looking at the time here, but Terry had mentioned that this is a two-part series around child welfare for the next 2 Wednesdays. Next Wednesday at 10 a.m. we'll have the second part of this conversation and be talking with foster care agencies and some young adults who have experienced the foster care system. We'll be joined by Grace Akers from St. Joe's Children's Home, Dale Settles from Sunrise Children's Services, Tia Humphreys from Voices of the Commonwealth, and Dr. Austin Griffiths from Western Kentucky University. And Voices of the Commonwealth will be represented next week, but also we've got a member of the Voices of the Commonwealth this week on who's been listening, Tamara Vest, who is not only a social work student at the University of Kentucky, but also a Voices of the Commonwealth member, and she's actually going to help close us out today.
All right, thank you, Shannon, and thank you guys for always holding these forums. They've been extremely helpful. They provide some sense of routine and normalcy, especially when everyone is, just stuck at home and not sure what to do. And I know that they've been very informative for everyone who has watched them, especially youth, especially people who work with youth. And I just wanted to thank again all of the panel members, Brenda Rosen, Dr. Miller, Elizabeth Caywood. Everything that you guys said was extremely, extremely important. And I picked up, as a social work student and as a former youth in care with lived experience, I picked up on a few things that you guys said that really meant something to me, with all of that knowledge and experience put together. And I just wanted to highlight those and kind of leave the call with on a positive note, with all of the good things that you guys brought up. So a few of the things that I noticed were that the telework and the new normal are decreasing turnover staff within DCBS, and it's allowing them to be more mobile and more involved in their communities. And to me, with lived experience and with doing internships with youth in care and families, I think that it's very good that our staff are happier with these new ways, because this is good for families that used to think that social workers coming into their home was a little intrusive, or youth that are in transition age and independent living, they don't want a social worker checking up on them. They're ready to be an adult, is what they say, and what I said. So I think that these new ways of telework helps decrease those worries for families and our youth. The first steps to opening visitations with biological families for youth, I know that that's extremely important, and that's something that I've heard just across the board, that youth missing visitations with their biological families or whoever they're having visitations with, it really hurts their emotional relationships and their mental health. So opening that up as a first step is extremely important. Extending those services to youth that are aging out is extremely important, and I'm glad that the cabinet is doing that, because I have friends as well that are still technically in care, but they're aging out this month or next month, and they have no idea what to do because they don't have jobs due to COVID-19. And it's just a very hard situation, and I'm glad that we're adapting to that and providing extra services to those youth. I know that Dr. Miller pointed out the well-being of Kentucky's children and families is dependent upon the well-being of our workforce. That is extremely true. Self-care is a critical component that should be incorporated into normal practices and should be a normal, intentional thing that we do every day, and not a response to certain situations. There are lessons to be learned on every level. So whether that's one-on-one with our youth or with our families, or involved in our communities or involved with organizations, there's something to learn from each of those. And work is a part of life. Dr. Miller pointed that out with the not having a work-life balance, because work is a part of our life. And I think that as a social work student, I have always learned that social workers and advocates, it's not a job, it's who we are. So I can see where this being our work is part of our life, because that's just who we are as people. So that's a very important note to have, is that not always trying to achieve that work-life balance, because it's just who we are as a person. It's not something we should try to balance all the time. And I also wanted to point out that May is Mental Health Awareness Month and also Foster Care Awareness Month. And I don't think those are a coincidence at all. And I think that we need to pay close attention to that. I know myself, I have heard, especially during this pandemic and even outside of this pandemic, we all know that our youth in care and youth that have aged out struggle with mental health a lot. And that's something we need to pay attention to and continuously provide support and services for that. And just like our youth in care, our staff and our families have shown extreme resiliency during these times. It's important that we continue to support them during this crisis, learning new ways to be innovative and making sure that we take this knowledge and apply it outside of the pandemic.
Thank you so much. I feel like, Dr. Miller, are you so incredibly excited that she is going to graduate from the College of Social Work here soon? Okay. Thank you, everyone, for joining us today. Thank you for those reflections. Those were wonderful. And thank you to all of the panelists who were able to be here and shed such light on this situation. We look forward to seeing all of you next week, and everyone be on the lookout for an email with a recording with all this information as well. All right. Bye, everybody.
Bye. Thank you so much.
Thank you.